Hi everyone, it's the Scrub Nurse, and are you ready for a little story time? Well, this is one of my stories from when I worked in the ER, and it's been a few years ago. Okay, maybe a lot more than a few years ago, but if you can't tell by the grayness that I'm turning into, I've been doing this for a long time, and I never thought I would be the senior nurse, but here we are. But anyway, this is a doozy that I will never forget this story. So I worked night shift, and I was maybe 2 months off of orientation, and it was my turn to take the next patient. And the radio report, it comes over, and EMS explains to us that they have a patient that they are bringing us that is complaining of right heel pain. They don't really go into much more detail than that regarding the heel. Everything else they are telling us seems like the patient is rather stable. So it was just going to be one of those typical 3 a.m. type of EMS brought patients that maybe didn't have a ride or a car to get to us. So that's why they called EMS. That didn't really seem like it was a major emergency that needed to come in at that time, but maybe the pain was getting to them where they couldn't sleep. We didn't really know. But we let EMS know what bed to bring the patient to, and I go get the room ready, and I'm waiting in the doorway for them to arrive to give me a report. And they arrive, and the patient's on a gurney. And the strange part is the paramedic that is going to give me a report is carrying with him a very large styrofoam lidded cup, which is very strange because we're like, did you stop for fast food on the way to bring us the patient? Like, who brings in their personal beverage when they're wheeling a patient in to give us a report? But I don't say anything. I just listen. And at the very end of the report, he hands me that very large styrofoam cup, which was also awkward. So I'm like, I don't want to take a drink after you, but okay. And the paramedic's like, no, you need to open the lid. And to my shock and surprise, I did just that. And as soon as I do, there is a smell that infiltrates the entire emergency department that if you have worked in nursing long enough, you know what that smell is, and you know why it occurs and what type of infection causes that type of a smell. And on further investigation, the reason that that patient was having right heel pain and was needing to be brought into an emergency room at 2:00 in the morning was because, are you ready? Her heel bone was in the styrofoam cup. The entire heel bone fell out of her foot. So after I put that lid back on very quickly because the smell was absolutely overwhelming, I get a mask and I put my 2 tea bags in there because that's a little trick that I learned that kind of helps hide smells and allows you to remain professional without making any type of gagging type of sounds. And I begin to assess my patient and speak with them. And they're like, yeah, I just need some IV antibiotics and a dressing change and I'll be on my way. This is the interventions they do every time that I come in here for this type of situation. So after a long pause, I say, yeah, that intervention may have worked in the past, but I don't think that you've came in before with a heel bone and a very large styrofoam cup. And I also don't believe that there is any amount of antibiotics or dressings that's going to fix that problem. So I don't see any other options than a surgical consult and an admission. And the patient did not like that at all. And the individual with them helped that patient barricade themselves inside of their ER room for a very long period of time. And it took security a while to get us into that room. So let's just say I didn't get off my shift on time, that night shift. And after getting into the room, the patient was still very angry and was like, I'm not being admitted. I'm not having a surgical consult. They're not going to take my foot. I know that I can just take some IV antibiotics and get a dressing change and I can go home. I'm not staying here. So many resources being available and brought in to discuss with the patient that the only option is going to be staying with us for a while and having surgery on that foot. Still not really accepting it, finally agreed to have admission to the hospital. And I will never forget. But if you all have any stories that you will never forget like that, please drop them in the comments, hit subscribe, and don't forget to follow the Scrub Nurse.